Friends, in this video we will cover Dr. Walker's image from page 189 and go over the items that he identified. Here would be the sacrum. Pubic symphysis is the cartilaginous fusion of the right and left pubic bones. He also identified the ischial tuberosity, kind of a rough portion of the ischial bone, and you can imagine that this rough portion might well be the origin of a muscle, and in fact the hamstring muscles and the adductor magnus muscle originate from this ischial tuberosity. Here's the acetabulum, the socket of the ball and socket joint into which fits the head of the femur. This is a deeper socket, more concave socket than the glenoid, and as a consequence, this is a more stable joint than the glenohumeral joint. However, it has less range of motion. Head of the femur here, neck of the femur, the most easily fractured part of the femur, greater trochanter, lesser trochanter, long shaft of the femur. On the anterior distal femur, they have glued here the patella. This large excrescence is a condyle, and this is a condyle. This is the medial condyle, lateral condyle. Superior to the condyles, we have the epicondyles. Here's the lateral epicondyle. Here's the medial epicondyle. And above the medial epicondyle, we have the insertion of the adductor magnus muscle onto the adductor tubercle. This rough portion here again implies that this could be the insertion of a muscle. It is indeed the insertion of the adductor magnus onto the adductor tubercle. Let's talk about the tibia. This is the tibial plateau, this big flat part of the tibia. Medial condyle, lateral condyle of the tibia, long shaft of the tibia, and we note here that the fibula is on the lateral aspect of the tibia. It's outside of the tibia. If this is medial, this is lateral. So the fibula is lateral to the tibia, and in the distal leg we have the medial malleolus, which is the palpable bony structure of the distal tibia. Medial malleolus, lateral malleolus, the distal fibula. Then we have here the tarsal bones, analogous to the carpals of the wrist. The metatarsals, analogous to the metacarpals, and the phalanges down here.